This is a 40-year-old woman who's undergoing liposuction of the jowls and neck, and Gerhard points out it's really unusual to begin with liposuction of the jowls. We usually do the neck first and then the jowls, but it doesn't matter. We'll get past that. So here, from an incision adjacent to the oral commissure, we're suctioning the jowls with the powered cannula. Now, just to show the difference in technique, I don't use a powered cannula for the neck and jowls. I use a powered cannula everywhere else. Gerhard also uses a powered cannula for the neck and jowls. So this is a matter of personal preference. Doing it from a superior incision like this is really a very good way to do it because you don't have much chance of damaging the marginal mandibular nerve, which you do from an inferior incision. And Gerhard, this looks like an incision below the earlobe, and of course there's going to be one on the other side, and there's going to be an incision under the chin, and then there are going to be two more incisions in the mid-lateral neck. So this is really a multi-incisional procedure.
Yes. As you can see, I think just below the finger here, my left hand, there's another incision which I like to do since we are using high volume tumescence, and there's always a lot of fluid left, so the drainage will be more easy to be performed through these distal incision points. Also, I want to say something to the cannula. We're using here a 2.4 millimeter cannula. It's smaller than on the rest of the body, and once we have been working on that whole surgical area, we change to a 3 millimeter cannula to have additional fat removal. The principle is here the same as in the rest of the body. We do a crisscross technique from all incision points. The past has shown that the skin bulges, the fat bulges of the jaws have not been removed completely, so that's why we have these two additional incisions at the lateral part of the mouth to have complete access and complete fat removal with the youthful straight jawline.
And the number of incisions is really a matter of physician preference. It is possible to do liposuction of the neck through a single incision right under the chin, but you get the extra crisscross effect from the incisions below the earlobes, and then you see suctioning being done from these lateral neck incisions, which also allow for drainage afterwards. Now, there's not as much drainage of tumescent fluid in the neck as there is in other areas. In fact, there's very little. Most of the fluid gets absorbed by the underlying platysmal muscle. But if you have these inferior incisions, then anything that wants to get out can get out. Here, moving along the jawline again.
Yes. And finalizing the case, one of the things which seem to be very important for me, since that is a little area, what usually would think I'm doing that quickly, one of the most important rules for the neck is that you take all the time you can afford and double it, to be very conservative with the aggressiveness and be very careful with it and being very continuous with the work. And the more you invest, the better the result will be.
In my view, about half the patients that come in that think they need a facelift just need liposuction of the neck. Of course, this is a much simpler procedure with a very rapid recovery within a matter of a few days. Some patients, have the procedure done on Friday and they're back to work on Monday. So this is a low morbidity procedure compared to a facelift, and the results can be absolutely spectacular. In fact, they usually are.
With no risk.
With no risk. So,
and over time you see the case how it develops, and the jawline more and more, although there's still heavy tumescence, appears.
At one time in my career, I would turn the cannula around and actually suction the fat off the underside of the dermis in order to maximize the skin retraction. But I think that's the wrong way to do it. I think you don't have to turn the ports around toward the dermis. Leave a little bit of fat on the dermis, and I think the result is really more natural.
and gives a beautiful skin retraction during the wound healing process with a natural look of the skin.